How would you describe your approach to patient care, specifically in treatments like this that can be subjective and so personal?
Yeah, yeah. So the first thing I look at is to make sure they don't have a medical problem, right?
Mhm.
There are inflammatory causes of hair loss that are treated medically, and quite frankly, wouldn't do well with hair transplantation. So I want to make sure that we're not doing surgery on people who don't need surgery but need something else.
Mhm.
Once we narrow it down to something that's treatable, and specifically androgenetic alopecia, hair loss related to your genetics, and commonly referred to as male pattern and female pattern hair loss, once we get it down to that, now it's really trying to figure out where they want the treatment and specifically where do they want the grafts,
Mhm.
because the graft supply is precious, it's and finite. And so you really want to put it in a place that's going to make a cosmetic difference. And for the overwhelming majority of people, male and female alike, it's towards the front. In the frontal hairline, sometimes in these what's called the corners, and then the frontal scalp. Some men need it here in their triangles. They're called the temporal points. And ladies too, when they're losing their edges towards the front. Now, there's a small number of people who want their crown treated here in the back. They want that treated first. And that really goes against convention. But if a person has enough supply, we can start there, but they need to know that later on they'll probably need something towards the front.